I love that.
Things that we need to change.
Can you tell us a little bit about oral health and how does it impact our overall health and well-being, both physically and mentally?
See, to me that's a no-brainer. Every time you look at a person, you see their oral health. It's the first thing we see about someone, isn't it? Their face and their smile. And we make judgments often about people based on their oral health. If they've got holes in their teeth, we automatically relegate them to a lower income group or a disadvantaged group. Those people are less likely to get jobs. They are less likely to feel good about themselves. They are less likely to socialise because they can't eat comfortably. So right in the face of that is this idea that your teeth impact all the other parts of your body and behaviours. Now we know there are lots of biological interactions where poor oral health makes your general health poorer and vice versa. Cardiovascular disease, diabetes, dementia and Alzheimer's, there are lots and lots and lots of examples where your teeth and the health of your mouth affects the rest of your body. We know about oral cancers, for example. Oral cancers at one point were killing more people than cervical cancers, and that is largely related to the fact that diagnosis is late. So people are not getting in and getting their mouths checked regularly. So a tiny lesion on the soft tissue in your mouth that nobody notices for quite some time turns into a big problem that then means half your jaw's cut away or it actually kills you. So oral cancer is a reason that you need to have your mouth checked every 6 months, right there, and we do it for cervical cancer, we do it for breast cancer, we do it for prostate, we do it for all the other cancers, but we forget that there's cancers in people's mouths. So the oral health, general health interaction is really significant. Your mouth's connected to your body, and of course it's going to be affected by everything else that's going on.
What do you foresee as an important innovation required in the future to improve the oral health workforce, and why?
There's a few things. My first answer to that is put dental in Medicare. Don't faff around any longer. That is one of the reasons why we have 3 types of dental consumer in our society. We have the middle to upper income who can afford world-class quality care. We have the people at the bottom in terms of income who are eligible for public dental services but rarely get in the door of a clinic, and we have a whole bunch in the middle between the very low income and the middle income who simply can't afford care and only respond when their face is swollen with pain and they can't breathe anymore, so then they go to an emergency department in a hospital. So I feel like we have been advocating this for years. There's all sorts of noise about it, but if we just put dental care into Medicare and started to treat the mouth in our health system the way we treat the rest of our body, that would be my number one policy change. It's time the Commonwealth Government stepped up and put the same amount of money proportionally into dental care that they put into the rest of our health service, because at the moment we're relying on the state system. About 10% of people on the waiting list in any 1 year get in the door of a practice, and that frankly in a wealthy country like Australia is not good enough. The other thing I would do is train more oral health therapists, which is the combination of dental therapist and dental hygienist. If we had parity in graduation numbers of those practitioners, what you would see is a much more preventive system, a system that makes checkups and preventive care much more accessible than it currently is. And if we put that into a publicly funded system and you start to have people getting their regular checkups and getting preventive advice and shifting the system into one that improves oral health, rather than one that just deals with toothaches and other disease. So there's a couple of things. I think I've spent some time recently working with Indigenous communities and rural and remote communities. We put an enormous amount of money in this country into getting nurses and doctors out into those communities. We put Zippo into getting dental practitioners into those communities. So we talked about the prevalence of disease in Aboriginal communities, and that is a flow over of colonisation and racism and a lack of trust in the system, but also a lack of practitioners out in those communities and a lack of Aboriginal practitioners who return to their communities and provide culturally safe care. So we need to be incentivising our graduates to work in rural and remote communities, and we need to be looking at the incentives that apply to doctors and nurses, medical doctors and nurses, that encourages them to work in some of those outlying areas and not just city-centric.
The last question, what areas of research surrounding oral health promotion and policy do you wish to see more involvement and funding in the upcoming future, and why?
Okay, so health promotion certainly is an area I've spent a lot of time doing research around, and one of the really important things we ought to be doing is embedding oral health promotion in other health promotion programs, because it has common risk factors with obesity and smoking and all sorts of, diet and so on. So oral health promotion that is embedded in general health promotion requires a lot of attention. We need participatory approaches to that. There's a whole lot of evidence that informs how we should be doing that better. I also think we need to know a lot more about our oral health therapist, hygienist, therapist workforce, what they're doing, where they're doing it, how they're being utilised, because we could be doing that a whole lot better and feeding that into policy. We know quite a lot about what dentists do. We know very little about what the oral health workforce does. The other real issue is that because a lot of our services are provided through private practices, we don't have good data on what's actually happening in those private practices. The evaluative mechanisms around the service delivery models are not there because they're dissipated in these tiny practices. I mean, there are a million research questions. How do we get practitioners to work in rural areas? What are the best ways to improve Aboriginal oral health? How do we develop participatory approaches that are going to meet the needs of Aboriginal communities to improve their oral health? Hundreds and hundreds of research ideas.
Perfect. All right.